Now, imagine if you were able to turn a bad memory into a good, happy one. Sounds a bit far-fetched, but that is what scientists at MIT in the United States were able, they say, to do with mice. Let's speak to the BBC Science reporter and former neuroscientist. My goodness, doesn't the BBC have some talented people? Jonathan Webb. Jonathan, so they've done it with mice. How?
Well, to begin with, they taught the mice a bad memory. They gave it a negative experience, so they put them in a particular room and gave it small electric shocks to make it anxious and afraid. But while that was happening, they labelled up the very neurons that were forming that new memory, and those are the ones that you can see in red in the diagram.
OK, so just, I mean, I know nothing about this. So OK, those, the neurons, what, are the
ones
red?
shown in red
and what is
inside.
The blue?
Blue is all of the other brain cells,
Right.
and the ones in red are the ones that are storing this new fearful memory. And they labelled them up in such a way that they could then go back to that part of the brain using a fibre optic cable which comes in that dark space you can see at the top,
Yeah.
and they could turn it back on whenever they wanted to.
Do we know, though, that memories were stored in this particular part of a mouse's brain?
Yeah, so we knew that that was likely to be where it was happening, and they've done very similar things before. But now what they did was take this mouse to a totally different room where it had no reason to be afraid, and using that light they could turn the memory back on, and sure enough the mouse acted afraid and, given the choice, would rather have the light off than on. But the most impressive thing, and the key part of this experiment, was what they did next, which is turn that memory on, an entirely new place, not back where it had learned to be afraid, and gave it a happy association. Instead of an electric shock, it was a male mouse, they gave it a female for company.
Yeah. I heard they gave it two, actually.
As far as I know, it was just the one.
Oh, right,
but maybe I didn't read the paper closely enough. But that actually managed to flip the association. So these memories, those cells that were storing the memory of that place, now actually had a positive association. So then, given the choice to have the light on or off, the mouse actually wanted to have it on. And even put back in the original room where it was taught to be afraid, it was much less anxious than before. So they effectively shifted the emotional association of that memory.
OK, that's fascinating. And we're going to go to another guest now, but presumably this could lead to something to do with the human mind, although mice have slightly different brains, as I imagine. Let's speak to Dr Jonathan Webb, Associate Professor of Experimental Psychology at the University of Oxford. Well, it sounds incredible, and presumably there will be hope to be some sort of human application to this further down the line. I mean, what do you think of it?
Well, I think that's the goal, is to have the human application, but I guess I would argue we already have the human application. We have very good evidence-based, trauma-focused therapies for problems of bad memory, such as post-traumatic stress disorder or even depression. So we have existing short-term therapies that can actually change the emotional association with the memory without being invasive. So I guess I would argue we're already there, although of course it's not an overnight fix. And I guess what this study is saying is we can hopefully take this to humans and develop a drug to change the association of painful memories.
Yeah, and we have electric shock treatment at the moment, don't we, for psychiatric disorders? But is it your sort of case that you don't really want to have any medical intervention which can be done by drugs? But presumably drugs have side effects anyway, don't they?
Well, currently there are no good drugs for post-traumatic stress disorder, and for depression there are drugs, but they are really only helpful for severely depressed patients. The best treatments for depression and post-traumatic stress disorder are short-term cognitive behavioral treatments. They last up to 16 weeks, so in a few months somebody can change that emotional attachment to various painful memories. And so the treatments are there, they're short-term, they don't have side effects. But having said that, there are really good drugs for severely depressed patients who are flooded with very negative memories.
All right. And Jonathan, I mean, does it show you as a former neuroscientist how unreliable our memories are? You know, we all think we have perfect recall for what happened, say, 15 years ago, and we don't.
It certainly emphasises how those associations can be changed. And in some ways it shows us exactly what's going on inside the brain when our own memories change. So when, say, in a psychological therapy, as we just heard, if we manage to change those associations, this gives us some idea of exactly what that looks like at the kind of cellular level.
And Dr. Webb, I mean, do you agree with that as well, that memories are unreliable and it is all through association?
Memories are incredibly unreliable and they're malleable, and I think there is an established body of research which shows that memories can be changed. And certainly in the treatments that we would offer for post-traumatic stress, the memory somebody arrives with, the trauma memory that they start their treatment with, is actually different by the end of treatment, so it's slightly more fleshed out, it's longer, it's more contextualized, and it's much less emotional.
Yeah, and psychologically, that manipulation, I mean, is that something that can be done by words, or does it have to be by association with something which is perhaps, you know, very traumatic?
It's both, actually. So the treatments are word-based, they are talking therapies, but what you might actually do with somebody who's been traumatized, perhaps they've had a really horrific car accident, is you would actually go back in the car with them and have a gentle drive, and you would be creating a new association, you would be creating a sense of safety in the car. So in that sense, it's beyond words, it's very action-orientated as well.
So it's like falling off a bike or falling off a horse, the first thing you do is get back on?
Slightly, but much more gently than that.
Okay, all right. Dr. Jennifer Wild and Jonathan, thank you very much. Jonathan Webb, our science correspondent.